Hold there. Dixie will be back later, taking the nation's pulse.
Now, back to Juliana. Juliana, we can help you sort this out. I think the best thing, actually, just show us straight away. Is it visible, for a start? A visible lump? Best.
OK.
That's not a lump on your testicle, which is good news. It's actually a cyst in the skin of the sac. It's absolutely nothing to worry about. It's incredibly common, and a lot of scrotums that they don't even notice. Your one, much does it bother you, or were you just gets bigger and bigger?
You know, but it's nothing to worry about, Giuliano, OK? And sometimes those little cysts, they can get bigger. Occasionally they get infected. If they get red and sore, then you may need some antibiotics. But they're certainly that removed, would you?
No, occasionally naughty patients wheeze, and they end up making it very red and sore, and it is not a...
Men are not good, are they? Do you know, all the guys that I see in surgery with a lump on their testicles, 9 times out of 10, they've been sent in by their partner.
It will be our big downfall, the fact that we can't deal with this sort of thing.
The clinic really is open 24/7, and Emma came in earlier for a diagnosis. Problem?
Do you have them anywhere else, Emma?
Yeah, I have them under my belly and my breast and under my armpits.
Can we just have a little look at your belly?
OK, so when you're on the 6-month course, so a long course of antibiotics, did it heal up then?
No, I didn't know.
No, OK.
No, as you're suffering from it, and it's basically a sort of chronic infection of the sweat glands, and we know that because of places where you see it. And it can be really quite difficult to treat, I'll tell you that now. I'm sure your GP's been trying to ask your GP for referral to a specialist, to a dermatologist, to get a little bit of specialist input now.
Just one thing, Emma. Have you been tested for diabetes? You're diabetic and you're running on a high sugar. That can make you more prone to infection, but that's been ruled...
Really now like to go and see a dermatologist to try and get on with treating this. It can be difficult to treat, but it is treatable, all right?
Whatever your condition, if you're not getting any better, it's really important that you go back to your GP, because he or she will otherwise assume that you're fine. And if you're really not getting anywhere, have a chat and ask if it's appropriate for you to have a referral. Embarrassed, shy, scared, or just too busy to book for a smear, I'm going to have mine now. And if I can do it on TV, then hopefully the rest of you can pluck up the courage or find the time to book for you. I've come to the Heartlands Hospital in Birmingham. That's completely painless. See, the screening programme saves over 4,500 lives a year, and if every woman came for her smears, we could prevent 75% of cervical cancer cases. So if you're offered an appointment, take it. It really could save your life.